the other name is mycosis. Um, this this moment about the mycosis. Mycosis is very widespread group of skin diseases, and this group of these diseases is very interesting and very important because a lot of information about these diseases is not presented fully in your textbooks, and sometimes it's very difficult for understanding. And that's why I present you now the information about the classification of these diseases, and according to this classification, the clinical cases which are very important. Sorry. Agent of these diseases, but it's not very, it's not right to use this term one kind of fungi, which may be as responsible for the formation of this group of diseases, because we know nearly 1,300 forms of fungi which are responsible for the formation of different forms of diseases. And these forms of medically important kind of the fungi are principally important too. The first is spore and mycelium. The form of spore is a form of the more high resistance to the environmental factors, because you can find the additional layer on the surface of the spore, and this additional layer is a factor of resistance of this kind of microorganism to the environmental factors, and we can include in these environmental factors the different medicines for the treatment of these diseases. Now, what the area is the target of action of medically important fungi? We know the structure in organism, and the name of the structure is keratin. And the target of action of medically important fungi is keratin, because in keratin enriched substance space, the process of multiplication of fungi is more intensive. And that's why we wait formation of the process of inflammation, and next step, the formation of clinical signs of these diseases in the keratin-enriched space. From the chair of histology, you know that keratin-enriched structures are first skin, superficial layer of the skin. Second is nail, because the nail is a product of the process of keratinization, and hair, result of the process of keratinization. That's why the first conclusion that we wait formation of process of inflammation and clinical signs of diseases according to the medically important fungi, and the name of this fungi is keratinophilic fungi, or keratin-like, keratin-love fungi. Because, I repeat, we wait the formation of these clinical signs in these structures. First conclusion. Next conclusion is that the formation of this process in keratin-enriched structures, we wait process where? We wait process on the scalp, we wait process on the face, we wait process of the trunk, or we wait of formation of these processes on the area with hair, such as scalp, face, and trunk. First. Second, we wait formation of clinically important signs of these diseases on the skin. That's why on the face, you wait process on the trunk, on the extremities, in groins, you wait process on the feet and manum. And last possibility, involvement of nails, and that's why we wait change, specific change, in the nails of the manum and feet. That's why I'm sure that it's more easy to understand the classification of skin diseases, fungal genesis. That's why we can conclude tinea, the name of the disease, fungal genesis. Tinea may be tinea capitis, localization of the scalp, caput in Latin, nominativus singularis caput, genitivus singularis capitis. That's why tinea capitis. First variant, localization on the scalp and involvement of the hair of the scalp. Second possibility, the similar involvement of hair on the face, and that's why tinea barbrae, or involvement of the hair on the face. And third variant, tinea involvement of the hair on the trunk, tinea corporis, because in this situation, involvement of corpus in the fungal infection. This is variants of involvement of hair. Involvement of skin. Possible variants. The term is the same. Tinea. Tinea faciae. Facies in Latin is genitivus singularis. Face. That's why facies faciae. Tinea faciae, localization on the face, skin of the face, not hair, skin. Possible involvement of groins, tinea cruris, cruris, genitivus singularis. Involvement of groins, groins where? Groins, auxiliary groins, inguinal groins, submammary groins. Then, involvement of the skin, feet and manum. Tinea pedis, tinea manum. Involvement of nails, inguinum. Involvement of inguinum of the feet, tinea inguinum mani, tinea inguinum pedis. After this explanation, I am sure that it's more easy understanding of the classification of these diseases, because it's very difficult for understanding. I know that it's sometimes very difficult to imagine the area of localization. Now, in this situation, the target of action is keratin. Now, clinical signs. First, one moment, about the possible involvement of skin. This moment is very easy for understanding, because involvement of superficial layer of the skin, because this area is enriched by the keratin, and that's why we wait the formation of process of inflammation in superficial layer. Some difficulties may be in involvement of hair follicle, because this moment sometimes is difficult for understanding. After the penetration of fungi into the hair follicle, after this penetration, the area of localization of the fungi may be in the inner structures of hair follicle, here, or in external parts of the hair follicle here. Two variants. First, in inner structure, and second variant in external structure. Why these variants are important for us? Because in the situation of their localization in internal structures, the name of the fungi is Trichophyton endotrix, endo or inter, trix hair, trichologia, the subject of study of hair. And that's why it's possible formation of different variants, clinical signs, in the situation of involvement of inner structure. And that's why the name is Trichophyton endotrix, and involvement of external structure of hair follicle. The name of the etiological agent is Trichophyton ectotrix, ecto or external. But differentiation in clinical signs, in the localization in inner structure, the intensivity of process of inflammation is very low. Intensivity is very low, but in the situation of their localization in external parts, the intensivity is very high. That's why involvement of hair follicle and clinical signs of this involvement are different according of localization of fungi or inner structures or in external structures. And now I present you this differentiation. Localization of the fungi in inner structure without intensive process of inflammation. The clinical sign is hair loss. Hair loss, but the process of hair loss is not completed. You can find only the part of the hair on the surface of the skin and drop like trichophytia, the name of this situation. Drop like trichophytia, the name of this form of fungal infection of the scalp, or tinea capitis, the first variant. And don't forget that you need, or your patient needs, in differentiation of this disease with other possible diseases with these clinical signs, such as hair loss. You can find in patients with lupus erythematodes, sclerodermia, but these processes are characterized by possible formation of scars. You can find scars in the area of hair loss. Hair loss may be in relation with insufficiency of vitamins in organism, predominantly in children. Don't forget about this possibility. You know about the hair loss in patients in the chemotherapy, in oncological patients. You know about this possibility. That's why your patient with hair loss needs in additional investigation. And in additional investigation in this situation is laboratory investigation for the confirmation of presence of fungal etiological agent. Next moment, possible second variant, very intensive process of inflammation, and in this situation you can find the hair loss which is enriched by the pus. And you can see the clinical picture of abscessus. The process is very intensive, and you can see, and the name of this situation is Carion celsi. Celsium was very famous ancient doctor who described few diseases, and among them this fungal disease. And the name is Carrion cell C. You can find these elements of very intensive process inflammation. Next moment, that you know that the formation of pus-containing elements or pastel is in relation with the action of bacteria such as Staphylococcus, and that's why we can conclude your patient needs in differentiation. Is etiological agent in this situation Staphylococcus or fungi? Why? Because in the situation of staphylococcal genesis, you can use antibiotics, but in the situation of fungal genesis, using of antibiotics is contraindicated because possible exacerbation of this disease. Don't forget, who will work in surgery, that process of abscessus on the scalp may be fungal genesis, and that's why your patient needs additional investigation. Now, the next clinical case. In both clinical cases, you can find the hair loss, don't forget about this moment, and the intensive inflammation process as a process of the trichophytia suppurativa or pus-containing elements. But it's sometimes very difficult for memorizing this. That's why we can conclude the two variants. First, hair loss, and second, formation of pus-containing elements or abscessus. Next moment, the similar. You can find these two variants on the face, and you know about the possible involvement of hair follicle, and we presented you these clinical cases yesterday when I described you and then explained to you the psychosis of the face. Psychosis may be bacterial or fungal. Next moment, involvement of the face, skin of the face. Etiological agent of this situation, as a rule, is microsporon. The name of the fungi is microsporon, and reservoir of this fungi are domestic animals such as cats, dogs, and possible transmission from this animal to the human, and then from human to human. That's why we can name this kind of fungi such as zooanthropophilic fungi. Zoo, possible involvement of the structures of animals, zoo, and anthropophilic or human. Clinical signs, as a rule, involvement of the skin. You can find redness of the skin, the color of this element is red. You can see the well-demarcated border in peripheral part and very intensive scaling on the surface. And this scale contains the fungi elements which are responsible for the transmission of this disease, such as mycelium and spores. Sometimes it may be character of epidemic in kindergarten, in schools, in the situation of dissemination of this disease in the pupils. And this situation is very important that you must remember that these elements, you can see multiple elements, maybe as a clinical signs of this disease. Don't forget red element, color red. You can see well-demarcated peripheral border and scaling on the surface of this element. Not only one, maybe multiple elements, such as in this situation. Next, you can see the possible involvement of groins or tinea cruris. Tinea cruris on possible involvement of groins, and very important, possible involvement of the inguinal groins and auxiliary groins. Factor of predisposition, high temperature, maybe hyperproduction of sweat, and in this situation, formation of conditions which are suitable for the more active multiplication of fungi. And in this situation, this disease is transmissible disease by sexual intercourse. That's why we can include this disease into the group of sexually transmitted infections. And clinical signs, very intensive itching, and you can find on the skin surface a similar, well-demarcated area, red color. You can see very intensive sculling on the surface of this red color element. And these factors which are responsible for the transmission, you can find on the surface of this element. That's why contact of skin with skin is a possible transmission from one person to the other person. But very important but, that the itching on the scrotum or in genital area of female very often may be non-fungal genesis. You can find these clinical signs in the duration of diabetes mellitus. You can find this specific change in neurodermatitis, in trichomoniasis in female, and few diseases which are characterized by possible itching in genital area but not non-fungal genesis. That's why your patient needs in laboratory investigation for the confirmation of diagnosis. The principally important clinical signs, very intensive itching, then formation of red, well-demarcated area. It's possible dissemination of this process on nearby skin. You can see the dissemination of fungal disease on buttock. You can see this well-demarcated area, redness of the skin, and very intensive scaling on the surface. The primary area in groins, and then you can find dissemination of this process on the buttock and formation specific clinical signs. Next. We wait formation of this disease on any part of the body where you can register the penetration of medically important fungi. You can see this unusual localization of fungal disease on the neck. You can see the specific well-demarcated area. You can see well-demarcated border in peripheral part, and you can see the scaling on the surface of this element. This form is transmissible from one person to the other person. This is similar, you can find the element on any part of the body. You can see on the chest, on the abdomen area, dissemination, because this formation of this multiple area is the result of dissemination of the skin surface and formation of numerous or multiple area of the pathological process. Next area of involvement, feet. There are, goodbye, close the door please, goodbye. You can see this moment, involvement of feet in process. And there are three clinically important forms which may be presented on the feet. The first, squamotic form. We can translate squama from Greece, such as scale. And principally important clinical signs is itching, but you can find very intensive sculling on the surface of the skin. And this scale contains the elements of fungi, and that's why it is responsible for the transmission of this disease. And we can conclude that it's in situation predomination of the process of alternation or proliferation of the process of inflammation. Second variant is dyshidrotic form. dyshidrotic form. In the situation of dyshidrotic form, you can find multiple vesicles on the feet. This is exudative form because predominance of the exudative component of inflammation. And this patient with this clinical form needs a differentiation from the dyshidrotic form of eczema, because we know the dyshidrotic form of eczema non-fungal genesis. That's why the methods of differentiation is laboratory investigation. And very important moment that the onset of fungal disease we can register on one extremity. But the involvement of the other extremities more later, that it's sometimes very helpful in the confirmation of diagnosis. In the situation of eczema, you can find change on both extremities at the same time. Intertriginous form. Intertriginous form, when you can find the change in intertriginous space. You can find multiple fissuring, very intensive itching. Very often we can find the combination of these forms. You can see in this clinical case, you can see intertriginous form here, and you can see dyshidrotic form, or intertriginous form plus squamotic form. It's possible combination of these forms. Next, involvement of